My name is Kay Dervishi. I'm a staff reporter with New York Nonprofit Media, and welcome to our virtual Nonprofit Checkup conference, where our esteemed panelists will provide insight on how to best assess the health of your organization during this time of crisis. I'd like to start out by thanking our sponsors, Mazars USA LLP, Citrin Cooperman, Grassi Accountants and Advisors, Jeffrey Sobel Consulting, Lockton Companies, LLC, Marks Paneth Accountants and Advisors, Paymerang, Revis Page Jump LLP, Roberta Katz Consulting, and Butch Binder. Now, there are a few functions I'd like to point out for our audience to use. If you're interested in asking a question to our panelists, feel free to click the Q&A button on the bottom of your screen. The moderator will take a few audience questions as time permits, and please feel free to upvote any questions that you find interesting in the Q&A section. You can also interact with the other webinar attendees through the chat function, also at the bottom of your screen. Just please remember to use the drop-down box to share the comments with all attendees and not just the panelists. And you can also change your Zoom settings if that's of interest in the top right-hand corner of your screen. And just a note to the panelists in the audience, I might just jump in just to give reminders about when the time is running short for the discussion, just to make sure we can keep on schedule. So don't be alarmed if I just pop in to make sure that we're staying on track. And with that, I'd like to introduce our first panel of the day, which is Effective Nonprofit Leadership and Operation. The panelists for today's first panel is our Amy West, the Executive Vice President and Chief Financial Officer at AHRC New York City, Jeremy Cahoban, the President and CEO of the Children's Village, David Garza, President and CEO of Henry Street Settlement, David Rotkamp, Partner and Non-for-Profit Practice Leader at Grassi & Company, John Eusenio, Partner and Not-for-Profit Practice Leader at Citrin Cooperman, and Alice Jump, a Partner at Revis Page Jump LLP. And with that, I'll hand it over to Amy. Thank you.
Good afternoon, everyone, and welcome to our session on effective nonprofit leadership and operation. At this point, I'm going to ask the panelists to introduce themselves. And panelists, in addition to telling us a little more about yourself, if you would, in one word, identify an attribute that defines a great leader. And I'm going to start with David Garza.
Hi, good afternoon, everyone. My name is David Garza, and I'm the President and CEO at Henry Street Settlement. I want to thank Amy. I also want to thank City and State for creating this platform and this opportunity. I think when you're talking about leadership, to be accompanied by all the tremendous leaders that are on this panel with me, I'm really honored and humbled. Henry Street Settlement is a 127-year-old poverty fighting organization on the Lower East Side. We deliver our services to over 50,000 New Yorkers across 18 sites. And with our history, we're one of the few organizations in the city that can say this is not our first pandemic. And I think in times of crisis, when human service organizations respond in times of crisis, a lot of the complexity and the nuances of the importance of human services kind of, I think, appropriately get put to the side, and the profound importance of some key areas, food, shelter, healthcare, and money, rise to the top. And for an organization like Henry Street, we are primarily involved in all four of those areas. And during a crisis, it elevates to a level where it is life and death for some households and some individuals and some families. And so we're really honored to continue service to the city and the residents of the Lower East Side during this pandemic. And leadership is extraordinarily important for organizations in crisis and always. And if I had to contribute one word that was going to help define or be attributed to effective leadership, I would say thoughtfulness. And I will hopefully be able to come back to that later and expand, but thoughtfulness would be my word. Thank you for having me here.
Thank you. John?
Thanks, Amy, and good afternoon, everyone. I'm John Eusenio. I'm a partner and practice leader at Citrin Cooperman within their not-for-profit industry group. On behalf of Citrin Cooperman and myself, I want to thank everyone for allowing us this opportunity to speak with them. And I hope your families and friends and you are all staying healthy in these times. You know, I've been auditing and working and consulting with not-for-profits for well over 20 years. And we've dealt with a whole bunch of different issues in the past, some not to the level that we have with this pandemic, but I think it's important that we take that collective knowledge and share it. And I really enjoy these conversations and panel discussions and our ability to leverage these technology tools as we move forward. In my role at Citron as practice leader, I help oversee the delivery of all audit, tax, and advisory services for our 17 offices nationwide. I liaison not just to help with compliance matters and regulatory matters, although they're very important, but also to help with best practices and thought leadership so that we can implement the best for our industry and sector. If I had to define one word or characteristic for great leadership, I think that word would be visionary, and we hopefully will be able to circle back to that later on. Thank you.
Terrific. David Rotkamp.
Now, John, it's funny, you and I are CPA partners, and visionary was my word as well. So I'm going to have to switch off of visionary and go to my second word, which was resilience. And there's a lot of resilient leaders that have gone through the pandemic and moving through the pandemic and and will also be post-pandemic as well. Good afternoon, everybody. And thank you, Amy, for allowing me to be part of this wonderful panel, serving with David and Jeremy and everybody else. We're thrilled. Gracia is thrilled to be sponsors of the City and State session today, and thrilled to be here on this wonderful panel of great leaders. I've been a CPA and working in the nonprofit area for 34 years. I am an audit partner and advisory partner and run the practice group of our nonprofit practice at Gracia Advisors and Accountants here in the metropolitan New York area, and also up and down some parts of the Eastern Seaboard as well. It's been a great career working in the nonprofit sector and working with so many wonderful leaders and organizations, from ones as small as $1 million as new startup nonprofits organizations to ones that are as big as $250 million nonprofit social service and healthcare based organizations. As a firm, we're committed to the nonprofit sector, and we've dedicated our nonprofit practice to helping those organizations achieve mission success and be visionary as part of their ultimate goals of running their nonprofit organizations. We're thrilled to have significant and wonderful clients within our nonprofit practice group, and thrilled to be spending 3+ decades working with the nonprofit sector here in the New York area.
Great, thank you. Jeremy?
Good afternoon, and thank you, Amy. It's great to be here. I'm the president and I'm Jeremy Goldman, the president and CEO at the Children's Village in Harlem Dowling. We're a 170-year-old organization. So like with David, this is not our first pandemic, and we survived the last one. We intend to bring all our people through this one, as we already have. We serve about 20,000 people every year. Our primary focus is creating love and belonging for children. We have a long history of dealing with the institutions and kids in institutions, and we've spent the last 20 years trying to undo that history and recreate a system where when children need help, that we give them what they need, but we also make sure that their families are safe and that they have families. So 2 words that would capture our entire mission: love and belonging. Create love and belonging at all costs. When it comes to leadership, what I admire most in leaders is transparency.
Great, thank you. And Alice?
Thank you very much. I'm very honored to be with my fellow panelists, and thank you, City and State, for having me. My firm represents individuals and entities in employment and dispute resolution. I'm honored to have nonprofits as my clients, both well-known ones and some startups. I'm on the board of several nonprofits, and it's a great part of my practice. I do conflict resolution, some real estate, and a lot of employment law. So I look forward to hearing what everyone else has to say. My word for leadership and for legal practice in general is empathy, seeing the other side of the issue.
Great, thank you. And I'm Amy West, the Executive Vice President and CFO of AHRC New York City. I've spent most of my career in the not-for-profit sector. Even when I was at Ernst & Young doing my boot camp, I specialized there in healthcare and not-for-profit clients. So welcome, everyone. And I certainly agree with everyone's words for leadership. If I have to add one, I would say agility. So with that, in order to focus our discussion today on leadership, we've prepared some questions, and then we hope to have 10 minutes at the end to answer any questions our participants may have. So let's get, our first question is for David Garza. And David, how is communication and relationship management with your board impacted during times of crisis? And also, how does it impact your teams?
Sure. Thank you, Amy. It's a great question, and I think it draws on some of the attribute words that were shared earlier. It certainly draws on Jeremy's word, transparency. It certainly draws on the accounting words like of visionary, and I think it pulls on my own word of thoughtfulness as well. As far as communication with the board, or communication with the team, or communication with the community for that matter, metaphorically or just in an effort to summarize it, what we say at Henry Street, it's always critically important to communicate by land, by sea, and by air, right? Because information gets to different people in different ways, in different modes, and different methods, and with different frequencies. And I think during a crisis, it's important to add like a fourth element to that. It's still critically important to maintain communication by land, by sea, and by air. But I think in a crisis, you also want to add underground tunnel to that. And that looks different depending on who the target of the communication is. I think if you're communicating with your board, some of the more standard land, sea, and air methods of communication, and you can, one can divide them up any way they want. But land, you have standard board meetings. Our board meets, multiple times a year, maybe five times periodically. But then, that's our communication by land with the board. Our communication by sea would be committee meetings. We have as frequent as 12 finance committee meetings a year, or 8 facilities committee meetings a year. So that would be communication by sea. It's much more frequent. It ebbs and flows. And then by air would be the kind of the carrier pigeon mechanism, or any kind of one-by-one dialogues you have with key board members throughout the year who can provide a specific area of expertise or counsel or guidance in a particular area. But in crisis, I think it's really important to add the underground tunnel. And by the underground tunnel, I mean, who is a subset of your board members that can help guide key decisions, whether they are decisions that involve risk or decisions that involve resiliency. Like, do you, deploy a certain set of resources, or do you, reallocate or reconfigure a particular, program or team or facility? Do you need legal guidance when it comes to taking a risk or making a decision? And often that group that you would go to by underground tunnel is different in configuration than it might normally be. You want to rely on people's different areas of expertise, but also their judgment, also their proximity to what's going on, depending on what the crisis is. And it's also contingent on their particular history. And I would say that some of the same nuances go in communicating with your team. There's always standard meetings, which are more by land. There's always email. There's always program by program communication. But again, the underground tunnel of communication during a crisis with your team is, who can be resourceful, who can be particularly creative, who's got relationships on the ground that you can leverage to be able to bring resources to bear to serve the population and the people that you want to reach where the need is the highest. So I think at both the board level and the team level, and I would add the community level, it's really important to have diverse mechanisms of communication and consistent, standard, transparent, thoughtful content of communication. But in crisis, it's important to add that subset that's a little bit more agile, a little bit more responsive, new configurations of people, where you can rely on people's skill sets and accessibility and judgment and experience that's particularly relevant to the crisis. And we've been really fortunate at Henry Street to have kind of a combination of lots of those opportunities. So thank you, that's a great question. I think communication is the key in so many areas, because if you can't articulate a vision, if you can't articulate a plan, if you can't communicate to deploy and leverage resources, you'll often be compromised in the ability to execute. So I think communication is central and key. And so thanks for that initial question to start us off.
Terrific. Anyone want to add to David's comments? Okay.
David at Henry Street, did you create any additional committees as part of your pandemic management team to be, more of that trusted advisor role that maybe the full board or specific committees that you've had in place already?
Both. So we increased frequency of communication with certain key committees like the Finance Committee and the Facilities Committee, but then we also relied on the Executive Committee, which normally gets activated only in special circumstances, and this was one of them. So yes and yes, it impacted our regular mechanisms of communication, and it certainly has upped the frequency, and we've activated the Executive Committee, which is there specifically for times like this. Thanks, Dave.
Great. John, can you share with us how nonprofit boards have successfully navigated through the pandemic?
Thanks, Amy. And I think when we talk about the pandemic and navigating through it, a lot of the theme that David just talked about, both Davids actually, on communications and crisis committees are things that are best practice that have really helped navigate you through that. The pandemic really has reemphasized the importance of having close ties and relationships between board members and the executive directors and executive leadership. It's helped to engage in those discussions and be able to leverage resources, address financial and legal matters as a whole, as well as liaising with different constituents, both at the public level and within the organization. I think reinvigorating that partnership and communication has really been helpful in developing new strategies that might be implemented, as well as calming some of the fears that exist both at the public level from your constituents, as well as with your own employees on an ongoing basis. I think a reaffirmation of mission and program has been discussed with boards, and making sure that they're staying true to their core mission and what they're looking to do for their donors and stakeholders and constituents in the realm. I also think that, unfortunately, boards have had to look at the financial impact and strategic management of the organizations and really make some hard and difficult decisions as to which programs should operate, where cuts might need to be made for expenses, for salaries, and the likes. And when you start to think about all that, how will that impact you going into the future as well? How will you be viewed from a development and fundraising perspective for your organization? So there's been a lot of different challenges that have been needed to be faced. From a financial level, you also had to look about sustainability and financial responsibility. Do you have the right resources to ensure long-term success of the organization? So they've had their plate full, as they say, at this point in time. But I think that the communication is really the key element in all of this.
Great. Anything to add to John's comments?
I'll just circle in very quickly, and I think John hit on something in his initial comment, and it really brings to the top the kind of the quality and caliber and nature of either the exec or the CEO's relationship with the board. And in some of the examples I mentioned before, like one of the things I went to the board with initially was a request to put our money where our values were. So I asked the board for, and it was fortunate that we came in to the pandemic from a position of strength, but essentially I asked for a bridge loan to help fund a response to food insecurity and to help support staff with a pay differential before government knew whether they were going to be able to meet that call or not. And in both cases, it took like an initial outreach to the board chair and outreach to some allies on the finance committee, so that when I introduced it to the whole committee. And that's what I mean by the underground tunnel, like go to initial people first who appreciate the values of the organization and can help move a decision through that's going to be required to serve our constituency the best. And in this case, it was our community who was hungry and our team who was being asked to go to work when everyone else was going the other way. And the board's responsibility to make what I'll call the right decision there was really important on our ability to execute. And so to John's point, if I didn't have that, text relationship where I could reach out at 11:30 at night for the request that was going to come the next morning, that might have been really difficult to advance, but I think it informs what we're talking about very directly.
Great. So David Rotkamp, as a volunteer board member and a CPA working solely with nonprofit clients, how are you working with your charities to support the leadership team?
Thank you, Amy. That's I have the pleasure of working in the nonprofit sector as long as I have. And when I get to serve on boards, and I sit on I think it's 4 boards I sit on right now. And some are local boards like the New York Council of Nonprofits and Governance Matters, one of our subsidiaries. And I've been board chair of Kahn, and also on a national level, like the National Multiple Sclerosis Society. You know, your role as a board member is different, but it's, whether it's a smaller organization locally or you know, $250 million large national organization. But at the end of the day, you know, as a chair, you know, to me, I look at myself as an extension of the CEO and really focusing on strategy and focusing on vision and ensuring that the board is in lockstep with the executive leadership team of the nonprofit organization, and that we're moving down the same path on a mission and vision perspective, getting to the goals and achieving the strategies that we want to achieve as an overall organization. As a treasurer of a board, you know, I'm thinking myself as an extension of the CFO and a resource to the CFO who's able to bring best practices as someone who's worked with hundreds and hundreds of nonprofit organizations over the years. And there are so many great board members that are out there in the nonprofit worlds who have their skill sets and their expertise. And I think every board brings that level of expertise from their professional skill set, and it's incumbent on the leadership team of the nonprofit organization to really tap into each of those board members' skill sets. I mean, I received a phone call, actually an email last night, like around 11 o'clock, about a nonprofit that is having a problem getting out of their lease, and they just can't afford to stay in their new space right now. So they're talking about, you know, what am I going to do? How do I get out of it? You know, and we're the auditors. I'm not a board member. And I said, well, you have a real estate board member, a real estate attorney on your board. That's the person you should really be focusing in and tapping into that resource and seeing what kind of options that you have. You know, we try as board members in each of the boards I'm on, and as we talk to our clients, we instill in them the ability and the need for them to really tap into that skill set of their boards and to be there to support the leadership, and not just in a pandemic period, but also, you know, in what we used to call normal times, whatever normal is, and normal's not going to be the same going forward. But it's really lockstep mission, lockstep vision, and applying strategies at all levels to move the organization forward.
Great. Anyone want to add to that? We've talked a lot about board involvement, and I think maybe it'd be interesting to talk a little bit about staff and teams. And Jeremy, I saw a Cranes article that spoke of actions that the Children's Village took early in March to support its people. How difficult a decision was it?
It was difficult, and I think David Garza touched on this briefly. Early in March, around the 10th, 12th of March, when we knew something was happening, but didn't exactly know how bad this could get, right? And nobody thought it would drag out this long and longer. While we didn't know what was happening, what would happen in the future, what we realized by that date was that closing was not an option for us. We had a large number, over 1,000 employees that needed to come to work. And many of them were coming from the hardest hit communities in New York City, Westchester, and in the other counties where we serve. They didn't have time to go out and empty out the supermarket shelves. They didn't even have the money to do that. They did not have safe homes where they could return to stay far away from whatever was happening in these neighborhoods. And those early conversations confirmed to us that we had to do something very different. And on March 15th, when we went to our trustees and said, look, we are not going to close. Over 1,000 of our staff have confirmed that they will keep coming to work. we want to do something very different. And we made a request of the board that we pay overtime and 25% to everyone that reported to the front line. And we made a proposal that would have completely absorbed our reserves, our internal reserves, because the cost would have been a little over $4 million. And of course, trustees wanted details, they wanted plans, they wanted to know about advocacy. And we said, you know, working with my colleagues at HSC and with David, we said, look, we're doing some advocacy with the city, but we work in a lot of places where we have no opportunity to get this back in the rate or the contract, and it's 4.2 million. I expected some pushback. We got none. It was a unanimous decision by the trustees. They said, look, you can't help others if you're not helping those that help those that are on the front line. So go do this. And it was not just the 25% and the overtime costs. It included technology, travel, food, access to prescriptions, access to medication, cash. People just needed cash. And being able to tell our staff that as long as we could, we would do everything we needed to do for them, I think was a game changer. We carried that strategy through June 29th, at which point we reached out to our staff and said, I'm sorry, we've just exhausted our capacity to do this. And no one complained. No one has complained.
Alice, it seems that from one moment to the next, we were in the office and then we were working remotely. And I know I struggled with this myself on how to manage staff remotely, because I'm kind of a pick up the phone and do you have a minute type of person. But how does an entity go about motivating and engaging employees in a remote environment?
Well, first of all, I have to say that Jeremy's approach is very admirable and laudatory, and to actually create that mission and that sense of togetherness and keep calm, we're going to get through this, is a really fundamental goal. And I think having people who, and we need to recognize that some people cannot work remotely, their functions don't allow it, or they just don't have the opportunity. So I just want to acknowledge that. But for a lot of us, remote work is now the norm. And echoing on what has been said before, communication, of course, is the key. It can be, the weekly Zoom meeting, the committee meetings, but it should be also impromptu and unscheduled, and just picking up the phone to someone you haven't talked to in a week to see how they're doing. Clearly, an important thing is to have the technology and the training to work remotely. And because I'm now on the phone, I can tell you that it's never a perfect thing, but to provide employees with the technology and the training. I know the first week that we closed our office and everyone went home, and it all seemed so sudden. It was like Friday you were there and Monday you weren't. Our office manager called up and said, okay, who needs printers, who needs paper, who needs ink? And that was a key sort of crisis management. Again, the sense of trying to create a unity when we're all apart is really important. I think the mission statement and just reiterating what you're doing and who you're serving is important. I just was at a virtual gala, which I guess is the norm now for fundraising, but they had a really wonderful video of their clients and their employees and everyone, in their various homes with their various pets, talking to each other. I think in terms of day-to-day management, I'm not one for monitoring log on and log off times or putting in filters on the computer so they can't surf the web. I think you have to focus more on achievements and accomplishments rather than process. I mean, I think we're finding out that people can work from 2 a.m. to 8 a.m. and get a lot done, and maybe take a walk with their kids during the day. So I think employers are showing more flexibility about that. And as long as as long as there's work's getting done and that people are engaged, I think that's fine. I know that there's now a cottage industry in sort of bigger organizations of sort of motivational tools in the remote workplace, and things like to try to recreate the social interaction that work gives us. So there's a consultant who will create, games, virtual games or trivia contests, or I know someone who had a virtual Halloween costume party or a meet my pet day. Those things, I mean, they seem a little hokey maybe, but I think people actually need them, because I really feel for the younger generation who I know my early professional career was my social life as well. And for people who are starting the workforce and are not getting that, I think anything that can try at least give them that sense of belonging and sense of community with the workplaces is a good thing. So it's a challenge, and there's lots of legal issues you have to deal with, cybersecurity issues, but the mission should be strong, and the empathy and community support that you have should extend to your employees.
Anyone want to add about remote working?
Amy, if I could, I've seen a lot of CEOs of nonprofit clients really excel in this area. Many are doing like a mid-Friday afternoon email to all the staff, kind of updating where the organization has gone. I've seen CEOs and COOs do emails once a week, or a 1 or 2 minute video chat that's taped and emailed off to board members to provide them with some information as to what's been going on in the organization over the last 7-8 months, as a means of creating the engagement. Another area I see is, these town halls that I've seen a lot of leaders do that. And in the bigger organizations, like with Jeremy and with David, I know that's hard to get, your hundreds and thousands of employees together, and you as well, Amy, in your organization. So maybe you break it up by department or break it up by program. But being able to have that conversation, even in a remote environment through a Zoom or some kind of video feed, you're continuing to create the culture of the organization and creating to permeate that culture throughout all your staff. That's the one area where I've seen a lot of organizations, not just the nonprofits, but other commercial entities, where they'll lose the culture because they've been now remote for 8 months, and not everyone's walking down the hall just chatting with each other and stopping into someone's office. And it could get somewhat lost in the shuffle when you're working in a virtual remote world. So I do think these town hall discussions, these pre-taped video calls, and other ways of leadership engagement, and as well as the board members, I see is really working well over the last 7-8 months through the pandemic.
Great. Anyone else?
Amy, I echo what David and Alice all said, and I think one of the other things that in discussions that I've had with various organizations and CEOs has become this concept of fatigue too, when it comes to meetings and constant interruption during your day when you're trying to get to your day-to-day tasks. And so, having boundaries and understanding the time and when to check in and when not to has been an important discussion that many have had with their employees. Everyone works at their own pace. Obviously, that trust element has to be there in order to successfully achieve your goals and tasks. But I think having the appropriate messaging to your employees, as well as to what your expectations are and when certain tasks need to be made, has to be even clearer when you're working in a remote environment.
Absolutely.
I would like to lift up something that Alice said. There are some positions that just can't be remote. There are others that can be remote, but only if we create flexibility. And I think good managers need to create flexibility when they can. That's a management burden that's non-negotiable. And that means that you're managing each individual based on what you know about them, what they've shared about their life. Maybe they have young children at home and the schools are closed and they need to work a split shift. Do what it takes to get your people through. That's exactly why we are in management.
Great. Anyone else? Okay. David Garza, How does establishing priorities in a crisis differ from establishing priorities under normal circumstances?
Yeah, I mean, I think we've heard a lot of it in terms of team building and communication and transparency and flexibility. But I know, at least the way, our culture operates, we often say when we're under normal times, as David put it, that speed kills, right? Like there's a certain, when you try to do, like we work in a very frenetic environment that takes a lot of reactionary impulses and to be responsive. But just the same, speed kills when decisions are made either too quickly or even borderline, recklessly, depending on the circumstances. Generally, speed kills, and our job is to slow the game down and be as thoughtful as possible, because I live by the words, it's not what you do, it's how you do it. And when you're thoughtful and when you can slow the management game down, that allows you to be honest and consistent and more fair and more inclusive and more transparent when you kind of dictate the pace. I think in a pandemic, quite the opposite is true. I think speed saves lives. And we've seen some of it already in terms of, Jeremy's communication with his board, on March 15th. We had that similar conversation about the bridge loan. We had similar conversations in our organization about redeploying people from our healthcare facility to our transitional and supportive housing units, about rediverting food from our after-school programs to our shelters, about particular services that were going to meet the needs of the seniors, about putting childcare stipends in place for people who all of a sudden had no childcare but needed to be on the front lines. All those decisions, whether it was money or service or support for the team, had to happen immediately, or those we served that were most vulnerable were going to become even more vulnerable because they wouldn't get the services they need. So I think it takes that speed kills paradigm and turns it completely upside down and turns it into speed saves lives. And in a pandemic, it was quite literal and figurative, and it still plays out that way. And so that's what I would say in terms of establishing priorities is different. However, for us, that strategic priority stack stays the same, right? So serve the community, support the team doing the work because they're inextricably linked and couldn't live without each other. Keep the doors open, otherwise all the rest is a moot point, and figure out how you're going to pay for it later. And although the priorities don't realign, I think the speed at which they're deployed certainly does. So that's how I would respond to that piece.
Great. Anyone want to add to that?
I would think to David's comments as CEO and as leader of his organization, whether it's slowing down or speeding up, setting those priorities is allowing the rest of his team as well to follow suit. And when the rest of your leadership team is going lockstep with the CEO, and they're seeing the efficiency and effectiveness of how decisions are being made and priorities are being set, they typically will move along in the same manner and work in the same pace in order to execute what has to get done, especially in pandemic times. I would agree with David. In a as we say, quote, normal circumstance, slowing it down and evaluating all the facts and circumstances, but also keeping in mind the mission of the organization moving forward is the right pace to be doing it at.
Great. And David Rotkamp, can you talk a little bit about what must a nonprofit leader do about financial sustainability during these challenging times? And it's not just now, right? It's into the future.
Sure, of course, absolutely. And again, to David's point, whether it's swiftness or slowing down, if you don't have the information in front of you to make those decisions, it's hard to make those swift, nimble, and sometimes slow down movements. Financial sustainability, and Amy, you and I have spoken quite a bit about this in the last 18 months or so. It's a topic that really is driven by metrics and is driven by financial knowledge. In the world we're living in the last 8 months, having key financial information to make those swift decisions is vital. And and you have to, as leaders, you have to look to your finance team, your CFO, maybe your finance committee of your board as well, and to gathering the information, the key metrics that you need to understand to move forward. And probably the most important metric I've talked to for the last 7-8 months is cash flow. You know, where is the cash coming from, and how is the cash going? To Jeremy's point, in order for him to make that decision on March 15th, he had to know he had $4.2 million available, whatever that number might have been, to be able to execute to take care of the staff. And he had to know that right then and there. You couldn't just blindly make that determination. So knowing where you are at the start of a situation, especially in crisis, and having the base information is there, but then scenario planning and forecasting take you into the future is vital. Because you need to know if your operation is going to be able to sustain based on the pace that you're spending, based on the cash that's coming in, as also based on the activities that you may need to do with maybe getting out of programs that just aren't working properly, especially in a pandemic situation. I've had so many clients that are down 20, 30% in revenue generation. And because they're down that much, they just can't do, you can't do more with less. That's such a, you know, the government says that all the time, and it's such a fallacy. You can only do less with less. And sometimes you have to make those tough decisions as a leader to reduce or cut in order to be able to move the organization forward.
Any additional comments on financial sustainability?
I was just anecdotally wondering whether you had a sense of whether the pandemic has helped fundraising or hurt it, or can you even make a generalization? No one has.
I mean, I could add a little bit. I mean, you know, the move to virtual has been helpful to organizations, but it still hasn't brought in the absolute dollars that an in-person event is. It's costing less, so therefore there's some better return, but not overall on an overall net basis. But I've seen some nonprofit organizations do very, very well in terms of fundraising right now, from corporations, from foundations, and really digging into their board. Leaders digging into the board and asking the board to really be able to go the extra mile to further support the organization, or find the connections that the board members have to help with fundraising. But on the other hand, I've seen organizations like on the national board that I sit on, contributions is what drives our organization, and we're down 35%. And when you're a $100 million operation and you lose $65 million of funding in the course of 12 months,
It's a lot.
You're just not the same organization anymore. And whether it's right sizing, reimagining, refounding, whatever term you want to use, you have to be able to shift into that model based on the fundraising that's coming in.
Yeah, I agree with that, David. I really think it depends on the type of social service, on the type of organization that you are. You know, those that were membership based, or associations themselves that were hindered by not being able to put on conferences or do these types of events, you know, felt it a little bit more. You know, I think when you start looking at other organizations that looked at contribution or diversified their revenue stream, you know, their ability to weather this storm in the current pandemic has probably been a little less drastic than some that rely solely on one or two sources of income as well.
Great. And John, with respect to risk, how do not-for-profits effectively plan for the daily risks that they face?
Yeah, that's a great question, and a tough one. You know, nonprofits really face the same economic, political, and technological, and these days, challenges that many for-profits face. It's no different. And the ability to consider all the risks that are out there really can have a significant impact on your sustainability or your liquidity and your ability to continue going forward. You know, unfortunately, risk is there. It's always there. It has been before pandemic, going to be there after pandemic. And what we need to understand is, how can you categorize the risk that the organization faces on a day-to-day basis? Do you have a committee that can be formed, or a risk committee with the audit committee possibly, that assesses ongoing risk? Because this is not a point in time analysis only. The risk changes over time. It evolves as your organization grows. It evolves as regulations change, or as different challenges arise. So looking, you know, if you think about the pandemic itself, and you think about risks like potential for increased fraud, which unfortunately occurs when you have a pandemic and issues with economic depression. Looking at cybersecurity threats, looking at liquidity and cash flow issues, or even reputational risk that organizations face. It's not just the financial. These are all things that holistically have to be considered at both the board level and the organization level. And so a tool that many have been talking about in the for-profit world forever is enterprise risk management. And that ERM process, as they call it, is something that a lot of nonprofits are starting to undertake in certain fashions. You don't have to do a full-blown integration, but at least understanding the universe of the risk that your organization faces helps you to strategically plan for them and hopefully mitigate some of the exposure that you may have. Again, it's an ongoing view. It's more of a proactive approach than what is the traditional assessment of risk, which is reactionary. You know, the last thing you want to do in an issue that an organization has is be reactionary or thinking about how to solve that problem while you're in it. Having an enterprise risk management plan helps you to set that plan well in advance and consider how you might respond. And the best example I can give for that is a response to a cybersecurity threat. You know, in this day and age, we all know it's not if, it's when cybersecurity will occur. So having a detailed plan as to who is going to respond, what is the messaging, how do you handle the financial implications, how do you get that done timely, is really a best practice that organizations need to take into account, because it's, as I mentioned before, it's not just the financial implication, it's also the reputational damage that an organization might face, and your ability to continue to fundraise into the future.
Great, thank you. And Alice, just kind of keeping with the risk theme, but kind of in a different direction. How can an entity deal with employees who have different risk tolerances with respect to returning to work?
Well, we're certainly seeing that as an issue in both our, I think, private lives and public lives. There are people for whom the pandemic is a total behavior modification, and they don't want to see anyone or go out. And there are people for whom there's a desire to go back to some sort of sense of normalcy. So I think that for now, at least, the issue is flexibility, as Jeremy was saying. What we are seeing is that I think I read somewhere that 80% of sort of corporate America is not going to require anyone to come back to work anytime soon. So they're going to allow it to be the employee's choice. The risk there, though, is that you have to make these decisions on a sort of a non-discriminatory basis. I mean, you cannot say, well, anyone who's over 50 can stay home, and those who are under 50 should come to work. That you have to be aware of protected categories, and you have to be aware of the disability laws about people asking for accommodation. So the employment laws are still very important when you're making these kinds of decisions. But I think for now, flexibility and knowing what the employee situation is sort of the norm. Obviously, if you have people coming back to work, you should be relying or be knowledgeable of the CDC and the OSHA protocols about self-certification and social distancing and mask wearing. And these are things that are changing all the time. And so you really have to devote resources to keeping up with what the government is saying. Now, it may not because the government is particularly effective at stopping things, but as a matter of legal liability, if you violate government norms or dictates, that gives rise to a greater legal risk that you might get sued. What I think is going to be really an interesting issue in the future is if a vaccine, or when a vaccine hopefully is widely available, are employers going to be requiring their employees to be vaccinated before coming to work? And that gives rise to all sorts of legal and privacy issues and health issues, and even maybe religious issues, that it's going to be quite an interesting employment law issue, as well as a social and economic one. So it's a I think the short answer, it's in flux, but for now, letting the employee make the decision has worked so far pretty well.
Great, thank
Unless, of
you.
course, they're an essential worker, which is a whole different category.
And before we get to Q&A, Jeremy, can you tell us what has the Children's Village learned about itself during the pandemic?
I think we've learned a couple things. The first is that everything we were giving the people we served on March 11th was not what they needed on March 14th. They didn't need more therapy. They didn't need more clinical intervention. They needed food, cash, safe places to be. And we had to figure out how to give it to them. We gave them 2 out of 3. We still haven't figured out how to give them safe places, because that's certainly a defining characteristic during this crisis, right? Those of us who survive and those that die are often defined by where we live and the kind of conditions that we live in. And race and poverty is that fault line. And we've had to grapple with that and go back to our staff, go back to our boards and say, look, we really need to talk more and more assertively about about race and poverty. We just have to, because people are dying based on where they live and who they are. And that's a piece of work that I know will continue well into the future. We've had to pivot and do it quickly, and also give voice to the issue, to the reality that we exist because racism exists. We exist because intentional poverty is around us, and not everyone needs to be poor generation after generation. We can do something about it.
Great. Okay, well, we have some time for some questions. First question, I'd like to know the role technology has played during the health crisis. Were you prepared to go remote? What worked and didn't? Are you prepared to return to the office safely during the best to protect staff, clients, and patients?
We were not ready with technology. We bought every Amazon tablet, Amazon Fire tablet we could, till Amazon put a ban on us because I think they thought we were reselling.
Jeremy, that's not an uncommon statement to make in many of the nonprofit organizations. They just weren't prepared to convert their work environment to a remote situation where they were forced to do so. And I think many struggled. And one of the things that we've learned, that we've seen over the last 7-8 months now, is it's taken some time, but most of our nonprofit clients have gotten up to speed. They've put in processes and policies in place to allow the employees to work remotely. They've been able to, whether it's computers or tech or tablets, it's the VPN lines, it's the remote access using the cloud or whatever the technology might very well be. They've been able to move into that model. And now I think it's really important that those nonprofit organizations memorialize what they've done, because they were doing it really by the seat of their pants for many, many months. And now they've been able to work within that model, now documenting it and utilizing that when the next situation, because whatever that may happen to be, you've learned again, you've reimagined something that you never really thought you may have had to do, and you'll have that as strength and knowledge as you move forward.
And I guess, David, there's always been a remote element in what you guys do, but do you think for the not-for-profit sector, remote is here to stay?
I think there are many nonprofit organizations that aren't necessarily essential businesses, where many have taken their back office work, their finance staff, their HR staff, and they said, I don't need to have all that space in Manhattan or out in Long Island or up in Westchester, and I can reduce my occupancy costs, I can reduce my utility costs, I can have folks work from home, I can provide them with the technology, and we can be just as effective and just as efficient in working in a remote environment. So I have seen that, and I do think it's going to continue going forward.
And I would just add, and echo, we were not ready at all. And I think as a sector, to go remote and to rely on technology the way that it's been required has been an extraordinary learning curve. But I also want to add that I say human services require human services. And so it's not just the technological capacity of the organizations providing the services, the communities that we serve. I mean, when Jeremy talks about race and poverty, and when you talk about the technology and the digital divide that exists there, it's been trauma on top of trauma on top of trauma. So it's the public health trauma on top of the economic trauma on top of the isolation that is sustained because of the lack of connectivity. It's extraordinarily difficult to deliver any kind of services to someone who doesn't have connectivity and connection. And it just exacerbates an already tragic reality for the fragile and marginalized communities that we serve. So, one of the things that I've been coming to grips with is that any solution around, through an equity lens or otherwise, it's going to require almost twice as many resources, right? There's you have to stop the bleeding that's occurring right now and provide kind of healing and response to the trauma. But then you also have to address the circumstance that created the fragility to begin with. And that solution requires a double, if not exponentially larger investment, particularly in the communities that we serve. Because for us to have the technology and the technological capabilities is just half of the equation. If the people that we're serving don't have it, it's a technological bridge to nowhere. So I just wanted to raise that up as well.
And a question posed, Jeremy, specifically to something, the actions you took early on. How are things without a reserve? Wasn't it risky to go this route?
It was very risky in March. It was less risky in August because we had some mitigation plans that paid off. We won't enter the next fiscal year on July 1st, 2021 with a $4 million reserve, but I think we'll get there with a little under $2 million. And I'm comfortable with that. That's an internal reserve that we build as management. Year after year, we just kind of put a little bit into savings, and that's the number. And I'm happy to go into the next fiscal year with a reserve that's half of what it could have been.
But Jeremy, to your point, I think you hit a good point in that organization. Nonprofits should be thinking about what are their reserves and how to build up some level of reserves for when that emergency type situation needs, and how do you build it into your current operating model, even as we move forward, past this at some point into the future. How do you think about providing for some kind of reserve in your normal business model, in your normal operations, to try to help build that internal reserve for when you do need that down the line?
Yeah, and when you think about it from a strategy setting standpoint, just like you said, David, understanding the nature of the investment for infrastructure, technology, and then delivering on program are two different things. And it's always been a constant battle between boards in the past as to how much do you devote to mission and how much do you devote to infrastructure, and setting aside some for reserve. So I think these discussions on a go-forward basis really need to be held and held more routinely as we see the impact that the pandemic has had on many nonprofits.
Okay, I think we have time for one more question, and I'm sorry we're not going to give this very important question the justice it deserves, but how do you balance the equity issues with work from home policies in an environment where the lower paid staff, people of color, are essential and cannot work remotely?
I'll start that off. I don't think you can. I think you need to be transparent and say it's not fair. This is the way it is, but we'll do two things. One is we'll be as attentive to you as we possibly can. Ask us if we are not doing something that we should be doing. Put us to the test. Challenge us in public if you need to. But we acknowledge that it's not fair. Two, we want to make investments in education and a career ladder so that you're not always in that same place. The problem with race and equity is so many of our people of color are put into dead-end jobs and they never move, right? We've all worked these jobs. I started on the front line. I bet many of us in this work started on the front line, but we moved. If we moved, why aren't others moving? And since we recognize that something's worked for us, let's make sure those same movements are available to those that are being put in these dead-end jobs and not allowed to move.
Good.
I agree.
Okay, panelists, I want to thank you. This has been a wonderful session and